Good morning, everyone, and happy Wednesday to you. And thank you for continuing to join us in the conversation about the transformation of mental health. And what we have been talking about and on an ongoing basis is the transformation of mental health, and simultaneously, I would say the transformation of who we are as social workers and what it means for us to be a part of something where we get to have a say in how services are, not just services, by the way, but how services are implemented to be able to be the most effective kind of services possible. The inclusion and the real inclusion of people who are recipients of care, including us as recipients of care, by the way, in the conversation about what a holistic, complete, and fully accessible mental health system would look like. Over the last, several conversations we've been having, one of the things that has come up is a question or a consideration as it relates to calling it and how everything happens in language, and calling it the transformation of health versus the transformation of mental health. And it made me think of, and so one of the things I wanted to share today as the conversation continues to be explored, and as we continue to look at this from multiple different angles. And what occurred to me today was whether or not talking about the transformation of mental health as the transformation of health somehow takes the focus off how important mental health is in overall health. Now, I don't know what the answer is, but it just made me think of different advocacy groups and the impact with different advocacy groups when issues and topics and needs, whatever they may be, are consolidated under under more of an umbrella term, and what gets lost in that process. And so, just over the last couple of days, I've been kind of wondering to myself, in making it the transformation of health rather than the transformation of mental health, so that we can do things that are inclusive, and that we operate mental health in very similar ways that we operate health, where there's no distinction, because we know that in order for us to be healthy mentally, we're healthy physically. And in order for us to be healthy physically, we're also healthy mentally, in whatever that might mean for the individual person, because that continuum is going to look different based on what health is for somebody. And in that, whether or not removing mental from health overall somehow has an impact where mental health is then no longer the focus at all anymore. And so I'm just sort of like reconciling some questions that I have, and not yet landed on any particular right or wrong or answer to them, but just questions I have about what's the impact if there is a consolidation. And we go back to like ancient Greeks, where everything was done under one roof. What's the impact of that? And also, can it be both? Can it be about the transformation of mental health in its inclusion in health in a different kind of way? Can it look how it is that might be being envisioned, and still call it something different? And I do talk a lot about how things live in language. And so, that's a place where I'm beginning to really explore and have some questions about if it's living in the language of inclusion, where there's no distinctions really between the kind of care somebody gets when it's their mental health and the kind of care somebody gets when it's their physical health, and it's all inclusive. And the byproduct of that hopefully means that there isn't the experience of stigma. However, on the other side of things, does that then have an impact on mental health, where somehow it no longer, like, the needs that are clear in the system that need to be addressed are not, because things are consolidated. So just some thoughts that I have for today. I'd be curious to know what it is that you think, and please join us in the conversation. Remember, we do these on Mondays and Wednesdays, and we also have an article that comes out every week. And we have a social work power certificate course that happens on Fridays between 3:30 and 5. All of this leading up to a panel and hopefully to the transformation of care for people. So that's it for me. I'm Karen Dubin, and I look forward to hearing what your comments are. Please put them below and have a wonderful, wonderful rest of your day.